Hey guys, Dr. Grizz at 918 Chiropractic, and I'm standing in front of what has become some of our most used technology, some of our most used devices in both of our facilities, both the Jinx and the Midtown Clinic. I have two here at this clinic, and Dr. John has one, looking at getting a second one. These are very, very nice decompression machines. What they're used for specifically is to be able to take a disc that's bulging, herniated, arthritic, and open it up to avoid a surgery and or to be able to legitimately change the shape of the disc. Here's how it works. It's really neat. So this is a healthy spine. In a normal functioning spine, you should have segments that move. When they move like they're supposed to, it rehydrates the disc, and that keeps it healthy. It doesn't allow for it to bulge and hit the nerves. We like it. Winner, winner, chicken dinner. What we do not like is when the segment gets fixated. It gets locked. It gets stuck for a long period of time. That causes the disc to begin to decay or causes a disc bulge or herniation. You've heard of those. The herniations is when it literally the disc squishes all the way out. It squishes all the way out, lands on a nerve, and wherever that nerve is going, it causes problems for you. So you may have had the sciatica pain, you may have chronic disc issues, you may have degenerative disc disease. You've heard of that. This device, by design, is specific to you. We had to order this one from North Carolina, and I believe that one came from Michigan. We got these because they've been using them in spinal hospitals. You may have heard of spinal decompression because chiropractors use them, but I'm going to tell you, they're not using these. These are KDT, Kennedy Decompression Therapy tables, and what makes them so effective is that we can treat all spinal degenerative disc diseases. In other words, for this patient, she's laying face down. She has a small bulge on the lower back. This is the setup that we would do for that. If you have a spondylolisthesis, that means one of the segments, one of the bones has slipped off of the segment like this. Obviously not a healthy thing. We don't want that to happen. So this device will allow us to have the patient seated and slide that thing back up under that. Here's what I want you to know. These devices are the #1 devices on the planet today to help avoid a spinal surgery. And so if you're in that conversation, if you're thinking about or you've been told that you have herniations, bulges, I'm going to tell you that these devices are fantastic for you. We see results with these, huge results. I can think of in the past 2 months, since we moved somewhat into the new clinic, I've had 2 spinal cases, 2 surgeries that I didn't cancel. The physician canceled them on the patient because they were no longer warranted. Is that going to be the case for you? I don't know. But I can tell you what I've seen. I can tell you what we do. I can tell you all the things and the protocols that we do. And we see results with these things through the roof, so much so that we have one in every clinic. I believe that treating you conservatively in the beginning, if we can avoid a surgery, let's do that. If we're not successful, research tells us there is no negative or ill effects from spinal decompression or chiropractic care leading up to a surgical intervention. Actually, a lot of those surgical interventions don't even have to happen. So what I want you to know is not only is 918 Chiropractic committed to you, we are also committed to the best technology on the planet. I did the research. I traveled a couple different clinics to see what the best units were. That's why we carry these. These are, I don't think there's any in our Tulsa area at all. There are several decompression units, but not very many Kennedy decompression tables. And that's not just the brand name, it's what it does. It's functional for you. Let's avoid a surgery if we have to, if we're even looking at that. These are the devices that you would see. If you're seeing this video right now, you've probably read it on a brochure and wanting more information. What I would tell you is just look up Kennedy decompression tables. You're going to see lots and lots of research. You're going to see coursework that I've actually completed and have certifications in, and Dr. John as well. So the thing is that what we want for you is I want you to be conservative. I really want to avoid a surgery. I just want you to be the best you can be using whatever device or protocol we need to do. This is Dr. Grizz at 918 Chiropractic talking about a Kennedy decompression table. Thanks.